Hello and welcome to everyone watching us from the operating room theater. Today we have Mr. Avocado. I'm going to start with this alcohol prep pad. It's super important that we clean the area very well where we're going to be working, so no germs or infection occur. While that dries, I'm going to put on my gloves. It's almost dry, but not quite yet. I'm going to open my tools. I have my scalpel here. That's what we'll use first. Then I have some forceps. They have an angle to them, so they'll really help us out. Some regular forceps if I just need to go straight down. This Mickey Mouse tool that will help to get into tight spaces. Some scissors if we need to cut any tissue. And a few more that I'll show you as we use them. I'm going to start with my scalpel here. It's almost dry, as you can see. Just had to change my glove because I saw that that one was dirty. Okay, I'm going to start by making a vertical incision. And as well as the horizontal one I just made. And also another vertical one. This will give us the best exposure. And I forgot to tell you guys that Mr. Avocado came in for a tumor resection that we found on the CT scan last week. So we'll lift this first flap up. That's our skin layer. It's our first layer. It's pretty tough, as you can hear. And the inside is a lot smoother. I'm going to take my scalpel and go just a little bit deeper. Right now we are in the fat layer. Now I'm going to take my Mickey Mouse tool. And like I said, this will help us get into those tight spaces. And this isn't as sharp as a scalpel, so this is just a little bit safer. So we don't cut any arteries or any veins, cause any extra bleeding. As we can see, there's a little bit of fat on there. Now I'm going to undermine. And I'm going to take my angled forceps and try to lift this flap of tissue, it's fat and muscle together. And there we have it. Here is our tumor that we're removing. As we can see, it's pretty big. We'll probably have to resect just a little bit more on the sides. And we can do that with a scalpel, or to be more safe, with our Mickey Mouse retractor. So, I'm going to do just that and get into those sides. I do have some hand sanitizer gel here, and the reason I'm going to use this is that it's going to make it more slick so that we can more easily get the tumor out. And I'm just going to put a teeny bit on my Mickey Mouse retractor. And I'm going to keep doing this. That gel is helping very much. This is a lot easier than I thought it'd be. I just don't want to damage any extra organs that I don't need to damage. I'm going to see if I can get this out with my curved forceps. Well, that was pretty clean cut. As you can see, here's our tumor. It's fairly large. I'm going to clean it off to give you guys a better view. Just slowly going to wipe away the tissue that's stuck to it. As we can see, here's the entire tumor. Got it pretty clean. It's a dark red, almost brown, because it has a very rich blood supply. And as we can see here at the top, this white little patch, and it has that circle thing in the middle. That's the main artery, and that is how tumors get their food supplies, through the blood. So that is where the tumor growth originated. So I'm really glad that we got the entire tumor out along with the main artery. Hopefully Mr. Avocado does not have his cancer come back. He'll probably have chemo or radiation after this still for a little while to kill off any cancer cells we may have missed. But for now, I'm going to put this into a specimen cup. We'll send that off to lab so they can dissect it and examine it further. Alright, back to Mr. Avocado. I'm just going to take this cotton tip swab and make sure that there's any extra things we need to wipe away and get rid of. There's a little bit of brown on there. It's not a big deal though. Could be just some dead tissue. Here's some more of the brown stuff. Like I said, not a big deal. And here's the last piece of brown tissue. think we're done with that. Next, I'm going to just inject a little bit of local anesthetic. This will help with pain after surgery, so Mr. Avocado doesn't need to take as much pills for pain. So I'm just going to inject straight into the abdominal cavity. Done with that. Next, I'm just going to irrigate a little bit to clean out the abdomen. The next thing I'm going to do is put this drain in. This will help to get rid of any extra fluid after surgery that collects in this area where the tumor was, since it's such a big gap of space to say. There's a likely chance that fluid could collect there, and that's not good. We do not want that. So I'm going to take my scissors and just cut this drain. And how we're going to insert it is we will make a hole on the side of the abdomen. So I'm going to do so with my forceps. As you can see, they poke through on this side right here, and that's where we'll insert the drain. So I'm just going to thread this drain through here. As you can see, it's coming out so the side. And then we'll have this portion rest in here. It's going to collect all the fluid. And the nurses on the floor will be able to empty any fluid that comes out of there. And then next I'm going to put this piece of tissue back in its place. I have to get it to go the correct way. There we go. Scrape this extra tissue off, and we'll put our flap back. We'll clean this area off a little bit, and we'll clean it again at the end. And now to fix up Mr. Avocado, we're going to sew him up. So I have a needle here that we're going to use, and I'm going to use these forceps to help me sew. Just going to grab the needle, and I'm just going to start sewing. We won't make too many stitches, but just a few to secure the tissue in place, and we'll staple over it also. This patient has really nice healthy tissue that's not ripping. Sometimes we'll have tissue that rips, so we can't suture it. We have to staple all of it, which is okay too. I'm just gonna turn the patient. Like I said, these are just big stitches to help us secure the tissue, so they don't have to be perfect. And whoever's still in the viewing gallery, thank you for sticking along with us. It was a long procedure, we understand. So again, thank you for sticking through with us. A little tissue separation is normal here, so this part's okay when we staple it. We'll make sure we secure it very well. I'm just gonna tighten this corner up as much as we can. See that one ripped, so we'll just staple that corner when we're finished. I just have a couple stitches left because the rest of the skin I'll staple. Two more left. Then we shall be done. Okay, I'm just going to cut the rest of this off. And we'll leave that pretty loose there because we still will staple like I said. So I have my stapler here. Just gonna staple a few of the places. Then I'm going to take this adhesive tape and this will be our final dressing. We'll just cut that. Mr. Avocado will be on bed rest until we see him next time in 1 week. So we'll come visit him in the hospital. We'll check on his drain every day and see what's coming out of it in case it's too much blood or it's not the right color. But for now, thank you guys so much again for viewing from our gallery. We're all wishing Mr. Avocado a speedy recovery, that he gets better soon, and that his cancer does not come back. I'll go tell his wife and 3 kids that his surgery was successful and they'll be able to see him in a few hours in his hospital room.